You know that feeling when you're just, well, not quite right. Like your body isn't quite fighting off the bad stuff. Now imagine that feeling, but for a horse. Especially a brand new, fragile foal. Today, we're taking a deep dive into the complex, sometimes challenging, but really fascinating world of equine immunoglobulin deficiencies. We're aiming to cut through the noise here, get you really well informed on this the crucial topic. We've pulled together insights from, well, a leading specialist guide and a really comprehensive veterinary consult. Our mission to help you understand the horse's incredible immune system, what goes wrong when that shield, falters, and the cutting edge ways vets are diagnosing and managing these conditions.
It really is remarkable. These immune issues, they can range from incredibly common problems in newborns, often preventable, actually, quote, to, on the other hand, these rare inherited genetic conditions that pose immense, sometimes, frankly, heartbreaking challenges. We're going to try and connect the dots for you, from the basic biology of these animals, right through to the very real impact it has on their health and their lives.
Okay, let's unpack this then. Before we dive into what goes wrong, maybe let's quickly get a handle on how it's supposed to work. What exactly are immunoglobulins, and what's their job in keeping a horse healthy?
Right. So think of the horse's immune system as like a highly sophisticated defense force. It's got two main parts. First up, you've got innate immunity. This is the immediate sort of rapid response team. It's nonspecific, which means it just attacks any threat it perceives pretty indiscriminately. It uses these specialized cells like neutrophils and macrophages. You can almost picture them as tiny Pac-Men, literally gobbling up invading bacteria or viruses. That's phagocytosis. And then there's also the complement system. That's a group of proteins that can directly damage bad cells or sort of flag them for destruction. So the core mechanisms here are eating invaders, phagocytosis, and inflammation. That's the body's natural response to injury or infection.
Okay, so that's the first line, the immediate responders.
Exactly. Then you have adaptive immunity. And this is where things get really precise, really clever. It's like the immune system's special forces. It learns from past encounters. It builds memory. And this branch also has two main components. First is humoral immunity. This is all about B lymphocytes. These B cells are the antibody factories. And antibodies are what we also call immunoglobulins, or IG for short.
Okay, so IG is immunoglobulin.
Precisely. And in horses, the real standout, the main workhorse immunoglobulin, is IgG. It's the most abundant, handles a huge range of threats, neutralizing toxins, viruses, helping other immune cells find and destroy invaders, that sort of thing. You also have IgA, which is crucial for protecting surfaces, like in the gut and lungs. And IgM, that's often the first antibody made during a new infection, acts like an early warning signal.
Got it. So these incredible innate and adaptive systems. But here's where it gets, I think, really interesting. You mentioned critical for newborns. How does a brand new foal, just hours old, get its immune system going? They're not born with everything working, right?
That's exactly right. Foals are born essentially immunonaive.
Yeah.
Their own immune system isn't really producing its own antibodies effectively yet. It's a key difference compared to some other animals that get antibodies across the placenta before birth.
Yeah.
For a foal, their survival literally hinges on something called passive transfer of maternal antibodies.
Passive transfer.
Yes. And this happens pretty much exclusively through the mare's colostrum.
Right. That first milk.
Exactly. That rich, thick first milk she produces right after foaling. It is absolutely packed with antibodies, especially that vital IgG.
Okay, so they drink it. Then what?
Well, what's amazing is the foal's gut lining, for a very short time, can absorb these large antibody molecules whole directly into their bloodstream. But here's the crucial part. That window is incredibly narrow.
How narrow?
Typically, it closes within the first 12 to 18 hours after birth, sometimes even faster. After that point, the gut changes, it closes, and they just can't absorb these big molecules anymore.
Wow, 12 to 18 hours. That's not long at all.
Not long at all. So what happens then is, over the first few months, those antibodies they got from mom naturally start to decline. And this happens before the foal's own immune system is fully up and running, producing its own antibodies efficiently. This creates a vulnerable period. We call it the immunity gap.
The immunity gap, okay.
And it's during this gap that they are most susceptible to infections.
Okay, so that really highlights the importance of that colostrum, that window, and then this worrying immunity gap. So what happens when that whole system, for whatever reason, doesn't work? when it fails at the start or maybe falters later on. We're talking about these immunoglobulin deficiencies, and you said they fall into what, two big categories?
Exactly. When that immune shield fails, we're looking at immunoglobulin deficiencies. And yeah, we classify them into two main groups. You got primary immunodeficiencies. These are the congenital, the inherited ones.
So
Genetic, exactly. Literally written into the horse's DNA. Often inherited in specific ways, like autosomal recessive or X-linked. They come from fundamental problems in how those key immune cells, the B and T lymphocytes, develop or mature or even make the immunoglobulins themselves.
Okay, so what are some examples of these primary ones?
Well, the classic and honestly the most heartbreaking example is severe combined immunodeficiency, or SCID. You see this almost exclusively in Arabian foals. It's a combined B and T cell deficiency. And a really devastating thing about SCID is that it's uniformly fatal. There's just no effective treatment.
Oh, wow.
Yeah. Affected foals often seem okay at birth, because they have mom's antibodies. But as those antibodies wear off, usually around 2 to 5 months old, they just succumb to opportunistic infections. Things like severe pneumonia from adenovirus, infections that a healthy foal would just shrug off. It's caused by a specific known genetic mutation.
That's incredibly tough. Are there others?
There are. They're rarer, but yes. There's X-linked agammaglobulinemia, or XLA. It mainly affects male foals, and it's mostly a B-cell problem, leading to really low or basically absent immunoglobulins. Then you have Fell-Pony syndrome, or FIS. That's another inherited one, autosomal recessive, seen in Fell and Dale's ponies. It messes with B-cell development, causes severe anemia too, and very low immunoglobulins.
Alas.
These foals, sadly, are often lost within just a few weeks.
Gosh, these sound really severe.
They are. These genetic conditions are like a missing piece of the immune system's foundation. They make the animal incredibly fragile.
Okay. Are there any others in that primary category?
Yes, a few more to mention. There's common variable immunodeficiency, CVID. This one's a bit different. It's a diverse group of disorders. It usually shows up later in adult horses anywhere from, say, 2 years old up to maybe 23. It involves a general ongoing lack of multiple immunoglobulin types, often with fewer B cells too. And selective IgM deficiency, IgMD. Here, only the IgL levels are low or gone. The others are normal. It can happen in foals or show up later in adults. And finally, transient hypogammaglobulinemia, THY. The name kind of gives it away. It's temporary. A delay in the foal starting its own egg production. Usually kicks in around 3 months when mom's antibodies drop off, and it might last 18 months, maybe even 2 years, before it resolves on its own.
Okay, so that's the primary, the genetic side. What about the other category? Secondary.
Right. Secondary or acquired immunodeficiencies. These are totally different, not genetic defects. This is when the immune system gets weakened or sort of knocked down by other factors, external things or underlying diseases.
And I bet I know the most common one.
You probably do. Without a doubt, the most common one veterinarians deal with constantly is failure of passive transfer, FPT, in foals.
Right, not getting enough colostrum.
Exactly. Just simply not absorbing enough of those crucial maternal antibodies right at the start. It's the most common immunodeficiency we see in foals, period.
Makes sense, given that narrow window you mentioned.
Absolutely. But other things can cause secondary issues, too, in horses of any age. Things like intense stress, think transport, heavy training schedules, significant malnutrition is a big one.
Like specific nutrients.
Yeah, especially deficiencies in vitamins like E and C, or minerals like selenium and zinc. Those are really important for immune function. Certain infections themselves can suppress immunity, like equine herpes virus 1. Other diseases too, cancer, like lymphoma, or metabolic problems like Cushing's disease, they can compromise the immune system. And of course, certain drugs, particularly long-term use of corticosteroids, are designed to suppress the immune system, or do so as a side effect.
Okay, wow. So a lot of potential pitfalls for the immune system. If a horse's immunity is compromised, how do you even spot it? What are the red flags a vet looks for? And what's the diagnostic process like? Must be like solving a mystery sometimes.
It absolutely is. It's detective work. The biggest, most common red flag, the thing that just screams immune problem, is recurrent infections.
Okay.
Pneumonia that keeps coming back, chronic diarrhea or gut issues, skin infections that just won't clear, joints getting infected repeatedly, basically infections that don't respond well to standard antibiotics or keep returning.
Right.
You might also see opportunistic infections. Those are infections caused by bugs that, frankly, wouldn't bother a healthy horse. Things like Cryptosporidium or that adenovirus we mentioned with SCID. Other general signs, too, may be failure to thrive, especially in young animals, persistent low-grade fevers, unexplained weight loss, all clues. And crucially, the age and breed are huge pieces of the puzzle.
Like you said, Arabian foal.
Yeah.
Think SCID.
Exactly. Sick Arabian foal, SCID, is high on the list. Fell pony foal, you think FIS. Newborn foal with sepsis, FPT, is the first suspect. Adult horse with recurrent infections, maybe CVD.
So the investigation starts with history and exam.
Absolutely. A really thorough history, vaccination status, past infections, breed, age, all critical. Then a full physical exam. Basic blood work, like a CBC, can give hints. Maybe very low lymphocyte count's a big red flag for SCID.
Mm.
Or anemia, like in Fanconi syndrome. But for the specific immune tests, the gold standard is serum immunoglobulin quantification.
Measuring the actual antibody levels.
Precisely. Usually done with a lab test called radial immunodiffusion, or RID. It gives you actual numbers for IgG, IgM, and IgA in the blood. For foals, checking IgG for FTT is absolutely vital. That cutoff is key. Below 400 milligrams per deciliter at 18-24 hours means total FPT. Between 400 and 800 is partial FTT.
And there are quicker tests, too.
Yes, thankfully. There are rapid field tests like ELISA or SNAP tests, mainly for IgG screening in foals. Really useful for quick decisions on the farm.
Okay, what about digging deeper for those primary genetic type?
Right. For that, we often need more advanced tests. Lymphocyte phenotyping using flow cytometry is a big one. It's a sophisticated technique that lets us actually count and identify specific types of immune cells. So we can see, for example, if a foal is completely missing both B and T cells that point straight to SCID, or if they're just missing B cells like in XLA or Fanconi syndrome.
Very specific.
Very specific. And then for the conditions where we know the gene, genetic testing is a game changer. It's available for SCID in Arabians and for Fanconi syndrome. It not only confirms the diagnosis in a sick foal, but critically, it lets us identify carriers, healthy animals that carry the gene, which is vital for breeding decisions.
Right, for prevention.
Exactly. So putting it all together, differentiating primary genetic causes from secondary acquired ones involves looking at the age it started, the breed, ruling out other diseases, and the specific immune test results. The genetic forms almost always show up early and cause repeated problems.
Okay, so the detective work leads to a diagnosis. What happens then? What's the path forward? Is there a cure? Or is it more about managing things? It sounds like some of these have pretty grim outlook.
It's a really tough question, and yeah, the answer varies hugely, unfortunately. For failure of passive transfer, FPT, the most common one, the good news is that early intervention works really well. If you catch that foal within the first 12 to 18 hours, giving oral colostrum, either from the mare or a good quality replacer, can fix it.
But if you miss that window,
If you miss the window, or FPT is confirmed by testing, then the life-saving treatment is an intravenous plasma transfusion. Giving 1 or 2 liters of plasma, rich in antibodies, gets their IgG levels up quickly, usually above that 800 milli-GDL target. And vets will often put these foals on prophylactic antibiotics too, just to protect them while their immunity gets sorted out.
okay, so FPT is manageable if caught. What about the primary ones?
That's where it gets much tougher. For SCID, the heartbreaking reality is there just isn't an effective treatment. It's uniformly fatal. Yeah. Once those maternal antibodies wear off, they succumb to infections. For others, like XLA, selective IgM deficiency, and CVA, it's usually about management, not cure. This often means long-term, sometimes lifelong, antimicrobial therapy to try and control those recurrent infections. Plasma transfusions might be used periodically, but honestly, it's often impractical and very expensive for long-term use, especially in adult horses.
And vaccines.
Good point. For something like CV, you have to be careful. Inactivated or killed, vaccines are generally okay. But modified live vaccines, absolutely not. They could cause serious disease in an immunocompromised horse.
And Fanconi syndrome.
Again, no specific cure for FIS. It's supportive care. But because of the severe anemia and the immunodeficiency, euthanasia is unfortunately often the kindest choice. So generally, the prognosis for most primary immunodeficiencies is guarded to poor. There are a couple of exceptions, maybe glimmers of hope, that transient hypogammaglobulinemia, THY. That can resolve on its own, usually by 1 to 2 years of age. And some rare cases of selective IgM deficiency have apparently recovered spontaneously. But SCID, FIS, CVE, XLA, those generally don't get better.
Right. Okay, what about the secondary causes, the acquired ones?
That's where the approach is different. The key here is almost always to address the underlying cause.
Makes sense.
So if it's malnutrition, you correct the diet. If it's intense stress, you try to reduce the stressors. If there's a primary infection dragging the immune system down, you treat that aggressively. If it's Cushing's disease, you manage the Cushing's. If it's medication-induced, you stop the drug, if possible. It's all about removing whatever's suppressing their natural defenses.
It's clear that prevention is just so critical, especially for those devastating genetic ones. So What are the most effective ways to actually prevent these immune failures in horses?
Prevention is absolutely where the focus should be, especially for the heritable conditions. It's the most powerful tool. For SCID and Failponi syndrome, genetic testing of breeding stock is absolutely essential. By testing mares and stallions before breeding, you can identify carriers, the healthy animals that carry one copy of the bad gene.
And avoid breeding two carriers together.
Exactly. That's the key. Avoiding carrier-to-carrier matings prevents producing affected foals. Simple Mendelian genetics, but it requires testing. It saves immense heartache and stops these diseases from being passed on.
Okay, that's huge for the genetic side. What about preventing FPT?
For FPT, it all comes down to colostrum management. It is the single most critical thing. First, ensure the foal nurses effectively and gets enough colostrum, ideally within the first hour or two after birth. Watch them closely. Second, it's smart to assess the quality of the mare's colostrum. You can use a simple tool called a colostrometer. Gives you an idea if it's antibody-rich.
Good idea.
And third, and this is non-negotiable really, measure the foal's serum IgG level at 12 to 24 hours old. Knowing that number tells you if passive transfer was successful or if you need to intervene.
And be ready to intervene.
Absolutely.
Hmm.
Have frozen colostrum from another mare or commercial plasma readily available. Being prepared can literally save a foal's life. Beyond those specifics, just optimal husbandry is fundamental for all horses. Good balanced nutrition, minimizing stress where possible, solid biosecurity on the farm, appropriate vaccination and deworming schedules. All of these things support a healthy immune system overall.
Seems like a lot hinges on getting those basics right.
It really does. And
Yeah.
looking ahead, research is always ongoing. Scientists are working to identify perhaps other currently unknown primary immunodeficiencies. They're developing better, faster diagnostic tests. And there's exciting, though still mostly experimental, work in areas like gene therapy. Could that one day offer a cure for genetic defects like SCID? Maybe, but it's complex in large animals. Also, understanding how the gut microbiome, all those bacteria in the gut, impacts immune function is a huge, rapidly growing area of research with lots of potential.
Really fascinating frontiers there. Well, today we have taken a truly comprehensive deep dive into this complex world of equine immunoglobulin deficiencies. We've looked at how the horse's immune system works, what happens when it fails, from common issues like FPT to those really tough, rare genetic disorders like SCID in Arabians.
Yeah, and I think a key takeaway, for me anyway, is just how much hinges on that critical, very short early window for colostrum. It's such a powerful reminder of how delicate and time-sensitive some biological processes are. And it really makes you wonder, doesn't it, how many other critical developmental windows like that exist, not just in horses, but across nature, maybe even in our own health, windows that we're only just starting to fully appreciate. What does this deep dive make you consider about, say, the broader challenges of managing genetic diseases, or even just our own personal health, where, prevention and catching things early are just so incredibly vital?
That's a really profound thought to leave everyone with, something definitely worth pondering. We really hope this deep dive has given you a clearer, maybe more insightful view into this vital aspect of equine health, and perhaps sparked some broader curiosity too. Stay curious, everyone, and keep exploring.